Dementia is a global health problem and it can affect anyone at any time, which is why, as an organisation, we have agreed to position level the training as essential for every member of staff, regardless of role. So that means that every person will complete dementia awareness at Tier 1 and has the opportunity to study further if they wish to.
Medical Aesthec has completed lots of transformation projects over the last 12 months. Probably our best highlight is the introduction of the Trusted Assessor model for the advanced paramedics in MWAS. Hopefully over the next 12 months we plan to introduce this to the whole of MWAS and become a pilot site for NHS England for this model.
Following the brand new emergency department, this has led to
everybody coming through one door into the emergency department. Patients can see the doctors in the private rooms and speak to the doctors in confidence without anybody else overhearing.
My project focused on the delivery of the NHS net zero targets by trying to reduce the carbon emissions from the hospital buildings. To do this, we're looking to de-steam the site and to remove the current gas-fired heating systems and replace them with a low-carbon alternative. At the same time, looking to introduce measures on site such as solar panels and to improve insulation of our buildings and to ensure we've got good heating controls to reduce our carbon emissions.
I facilitated focus groups in the community to help capture the voice of parents. It was part of our transformation within health visiting, and we wanted to make sure that we listened to parents and understood what their needs are in Tameside to help shape our service to meet their needs.
Here in EAU we have implemented an IQP into bedside documentation. This has been formulated following a recent RED accreditation. So we collaborated as an MPT effort, did a deep dive into our actions and formulated a plan on how we could make sure that we are actively engaging with staff and undertaking peer-to-peer progression. And we developed the bedside documentation checklist, which following a analysis and review, we have seen that it has improved in regards to our accreditation and we're now amber.
As part of the elective recovery, the Trust has worked really hard on achieving our RTT, which is referral to treatment targets. Every target set we have met. Our wait times have reduced quite dramatically over the last 12 months.
My quality improvement project was to address the training, competency and development of staff in the blood morphology section in haematology. The Quality Slide programme has been implemented to support staff in their competency development and training so that they are now able to confidently do blood films, and therefore this improves our turnaround times and reduces any delays to patient care.
Within corporate information, we use Power BI as our primary choice of data visualization. Over the last year, we've rolled out a lot of Power BI dashboards, so whether you want to look at exact performance report, use our operational dashboards to interrogate your own data, or access our apps such as RTT and waiting list and outpatients. All these Power BI dashboards can be found on our SharePoint site.
At Tameside Hospital, we're committed to transforming our urology service by making the best use of the multiple sources of data available to us. By analysing this data, we've been able to drive improvements in our service, reducing new outpatient waiting times, improving referral to treatment times, and meeting key cancer standards. These changes are already making a real difference to our patients, and we're excited to continue the journey of improvement.
System Development Support Team have launched the Patient Engagement Portal. This is taking over from Healthcare Commons, who currently provide their own portal to us. This will save the Trust a huge amount of money because it's an in-house portal, so therefore we're not paying a third-party supplier. We've gone live with endoscopy and we're currently in the process of going live with outpatients.
The improvement project that I've been working on is the Business Hub, and this is centralising all the admin functions across facilities to ensure we've got compliance and efficiency. The benefits of doing this improvement project have included standardisation of all processes, compliance, ensuring we've got an audit trail, reduction in duplication across services and clearer communication.
In the last year, research and development have been involved in the implementation of an easy-to-use point-of-care pharmacogenetic test on NICU. Success of this test will be reducing aminoglycoside hearing loss in identifying patients with this gene variant.